We underestimate the power of an average life, and so did I. I was 20, doing my medical internship, till I fell sick one day. Just like any of you would do, I popped a pill and got on with my schedule. But what happens when it doesn't get better? You have high fever, chest pain, you've lost a lot of body weight. You're rushed to the hospital. The doctor runs some tests and tells you, you've been diagnosed with tuberculosis, TB, a word that none of us want to be associated with. At first, you will deny it. You were fit and active. You didn't live on the streets. You ate right. How did this happen to you? Isn't this a poor man's disease? So you have questions, but your doctor is too busy to answer them. It's been 5 months now. You're still sick. You've lost over 12 kgs of your body weight. Finally, you undergo a complete body scan. But it's too late. You've lost both your lower lungs. Obviously, you then go to the best doctors in the best facilities. And you did study medicine, so you know the basics. Primary TB means drugs that can work on you will work on you. But in certain cases, the bacteria can become stronger, making them useless, something that you fear the most. And turns out, most of them won't work on you. 9 out of 13 precisely. So your doctor applies for a new drug that can potentially make your treatment faster and better. But you don't qualify for that because your heart beats too fast. You're then put on heavy medication that has crazy side effects. Not 1, not 5, not 10. 20 pills a day for the next 730 days. And it's expensive. So you go tell your mom that you want to give up. But your mom won't let you break. So you're alive and breathing, yet completely paralyzed. You throw things and break them and scream inside pillows. But TB isn't spoken about. So you go online looking for content, articles, videos, blogs, and there is nothing on life after this. Just people saying, you should be happy you survived. Now, is that something you want to hear? That you're born just to stay alive? I don't know about you, but I was sick of this. And that was my wake-up call. I just had to give people something that I could not have back then. That's hope and belief. And what would change things were my actions. So I decided to do a small marathon on active treatment. I never expected anyone to support me, but turns out a few people were crazy enough to do that. And that's all I needed. The question was, would I be able to finish the race? And guess what? Turns out I could. And I distinctly remember the feeling I had at the end of it. I felt normal. Never in my wildest dreams had I imagined feeling normal could mean so much. And I couldn't stop there. So just 2 months into finishing my treatment, I was already climbing 20,000 feet at Stoke Kangri. Another crazy decision, a situation that I totally underestimated. But I did make it to the top. And at the summit, I was speechless. It all flashed back in a fraction of a second. Those pills, losing my lungs, side effects. But hey, to look back, I was lucky. And there are millions others who do not have the support that I did and depend solely on the system to give them what they need. So how big is the problem? India has 2.2 million cases of tuberculosis. That's the highest in the world. An average drug-resistant TB patient consumes 14,500 pills. And TB is curable. But people die every single day because of it. Other times, the disease is cured. but people are disabled for life. And in a country like India, where most people might not get quality services in the public sector, go to the private sector. And they're driven to live in poverty under deaths. Efforts are being taken to fight TB, but are they enough? And the bigger question is, what was missing for the patients? In a country where millions face the same problem, why do people feel isolated and lonely? That's because no one talks about it. I remember when I came out with my condition, people reached out to me seeking advice, asking questions. And I realized survivors can be the best mentors in their own capacities. Fortunately, I found others who thought the same way, and together, Survivors Against TB was born, an organization that focuses on patient-centric care. Fights stigma, beats the myths around TB, empowers patients, motivates them to finish their treatment, teaches them that your problems do not define your life. And we do national level advocacy and express our views very, very boldly. We are trying to drive a change in the system. Why the system? Because this system isn't just the government's problem, it's your problem, and it's my problem. If one man fails to adapt, he dies. If a system fails to adapt, it takes thousands with it. And it starts with people like you and me, who can kill the stigma around this. So that a wife can go tell her husband that she has TB without having the fear of being thrown out. So that people don't have to go to the bathroom to pop dozens of pills just to avoid questions. So that a child can have friends when he's growing up. Because something as simple as being able to talk about your disease can mean so much to patients. It's up to each one of us how we decide to treat people that need our help. Just remember that the change starts with you. Thank you.